Good morning. My name is Esther Lisenge. Today I will be meeting with Mr. Bibi with a chief complaint of depression, eating out of control, and increased use of alcohol. Mr. Bibi was referred to me by his PCP, Dr. P. Bibi wants to use a medication and therapy to control his symptoms, and I already had an encounter with Bibi. Bibi's history of present illness. From our last encounter, Bibi reported that he is a 20-year-old male and he presents requesting his help owing to a change in his mental status and behavior. Bibi is undergoing an apparent distinct period of elevated and irritable mood, which has lasted for at least 3 months since he came to Houston. Patient is euphoric and grandiose, seeing himself as an accomplished, prolific writer. The patient is anxious and enraged by the request of his mother for him to return to school. He was curious to know why this marked uncharacteristic argumentative behavior. The increased eruption of laughter even when alone, uncontrolled gambling, and unusual thoughts. Bibi reported that recently he has been eating more than normal and has increased his consumption of alcohol. He is putting on a lot of weight and that troubles him. Reports lack of sleep. He said he is already rich and famous even before the end of this journey. Bibi is observed with pressured speech and impaired judgment. Patient has just moved into a new town. His new school has increased his anxiousness and acts as a trigger to his increased stress and depression. He has also been separated from his girlfriend, his childhood sweetheart, who is back in Arizona. Noted to be talkative and would not allow us to finish the question for him to give us his answers. Bibi is of African American descent with no religion or any other specific cultural belief or practice that might be the cause of his present symptoms. He denies any illness, any illicit substance use while admitting to increasing food and alcohol consumption, according to him, like all the other great novelists do. Effort by his family to discuss and understand his recent change in thinking and unhealthy behavior has been met with a loud and rambling discourse, and he has angrily accused his parents of wanting him to stay subjugated by the tyranny of depression. He is currently being treated for depression and insomnia, presently on Lexapro and Klonopin, prescribed by his provider in Arizona. Bibi indicated that he is out on his meds. The patient is not at this moment acutely a danger to himself or others. All patients' vital signs are within a normal limit, with only his BMI that was 40 and of concern. Review of system. Bibi's review of system was within normal limits. Psychiatric. Patient report feeling depressed but improving and agreed to some frustration. Feeling of worthlessness triggered his gambling lust, and by the fact that people will not let him do what he wants to do. He denies panic attack, racing thought, reckless behavior except gambling and drinking. He denies hallucination, obsessiveness, persistent thought, or compulsive ritualistic act. Denies nightmare and hypervigilance. Past psychiatric history. Bibi saw a psychiatrist 3 months ago in Phoenix, Arizona for depression and insomnia. Patient reports a history of maniac attack a year ago. There is no history of inpatient hospitalization, suicidal ideation, homicidal ideation, or self-injurious behavior. Substance abuse history. Bibi reported a history of alcohol use and cocaine abuse since when he was 18 years old, and that he stopped using cocaine after his best friend died of an overdose last year. He denied blackout, seizure, and tremors. Medical history. He reports no history of trauma, no surgical history, reports no serious illness, no hospitalization. He could not remember when he had his last checkup. Allergy, no known drug allergy. Developmental and social history. Baby is in developmental stage 6 according to Erickson's stage of developmental. Okay, according to Erickson's stage of development, dominated by crisis of intimacy and isolation with love as a virtue. Bibi reported that he was born and raised in Phoenix, Arizona, and has just moved to Houston 3 months ago, and that he is the only child of his parents. He lives with his parents, who were married and live together. He is a current student in Houston Community College. However, for the past 2 weeks, he has missed college classes while staying up most nights until 4 or 5 a.m. writing his books. Bibi indicated that he is not a social person and is sexually active. His girlfriend is in Phoenix, Arizona, and they are communicating almost daily by phone. He has never been arrested and he has no financial issue, no history of abuse. Family history. He reports that his father is 57-year-old, a journalist, and was an alcoholic, but he's been sober for almost a year, and that his father took to alcohol when he lost his own father some 7 years ago. His father has no other mental issues. His mother is a 50-year-old nurse, works at a medical center, reports she is depressive. Assessment. Assessment tool use. Primary care evaluation of mental disorder. PHQ-9 depression screening. Genogram. Screening for and identifying family patterns of major depressive disorder and bipolar 1 disorder. Based on the reported present history of illness, past medical and psychiatric history, family history, patient's social developmental history, and based on DSM-5 clinical diagnostic guidelines, Bibi appears to be suffering from 1. F31.31 bipolar 1 disorder, F33.1 major depressive disorder recurrent episode, F50.9 unspecified eating disorder, F10.10 mild alcoholic use disorder, all of which are functionally impairing his day-to-day performance. Differential diagnosis: generalized anxiety disorder, panic disorder, post-traumatic stress disorder, bipolar 2 disorder, mood disorder due to general medical condition, substance-induced mood disorder, personality disorder. Therapy plan. Our expectation is to freely identify Bibi's core belief and what he thinks is the cause of his problem. We shall then assist Bibi to change his distorted thought pattern and dysfunctional assumption and give him tools to use in dealing with identified problems. Bibi should be able to live a life with reduced functional impairment. We agree with Bibi that we are going to be incorporating 3 therapies to help alleviate his symptoms: motivational interview, cognitive behavioral therapy, and interpersonal psychotherapy. Are 3 therapies that are clinically compatible and helpful to patients with Bibi's symptoms. And there is a strong body of research and evidence-based practice that has been shown that these therapies to be a highly powerful and effective treatment for symptoms of clinical depression in the context of life events. 1. Motivational interview help us to establish a positive relationship with Bibi and to prepare him for change, especially with alcohol use disorder. Motivational interview is a directive, client-centered counseling style for eliciting behavioral change by helping clients to explore and resolve ambivalence. It is most centrally defined not by technique but by its spirit as a facilitative style for interpersonal relationships. BB will be able to identify areas of his personality that is acting as a barrier for positive relationship. This program will work across all cultures. Keywords: motivation, interpersonal, relationship, counseling. 2. We also use cognitive behavioral therapy, capitalizes on the fact that our thoughts, emotion, and action are all interconnected and can influence one another. With CBT, BB will undergo cognitive restructuring. This process will focus on correcting flawed automatic thought patterns by learning how to become more aware of the role or our core beliefs that create these automatic thoughts and dysfunctional assumption. The role these thoughts play in our mood, how to identify these problematic thoughts, and how to change or correct them. This program will rewrite BB's mind, taking away negative core beliefs that are embedded in his subconscious mind. This therapy is not culture sensitive and can be used across all cultures. Keywords: core belief, automatic thought, dysfunctional assumption, emotion, behavioral pattern. 3. Interpersonal psychotherapy. It's a belief attachment focused psychotherapy that centers on resolving interpersonal problems and symptomatic recovery. It is an empirically supported treatment that follows a highly structured and time-limited approach and is intended to be completed within 12 to 16 weeks. IPT is based on the principle that relationship and life events impact mood, and that the reverse is also true. Depression affects people's relationship, and this relationship further affects their mood. BB is having a relationship problem with his family that affects his mood and increases his depression. We are going to use this therapy to resolve his interpersonal, family, and bipolar 1 disorder uses. And bipolar 1 disorder issues. This therapy can be used across all culture. Keywords: relationship, depression, psychotherapy. Day 1 with BB motivational interview. Good morning, sir. Again, I am Esther, a student nurse practitioner. I will be spending some time with you today. Is it okay for me to call you by your initial?
Yes, that's fine.
Okay, Mr. BB, this video will be watched by my instructor and maybe my classmates. Do you consent for me to go ahead with this video?
Yes, I do consent.
Thank you, BB. I will start by stating that BB is the historian and is a reliable historian. So BB, can you repeat the reason you came to see me?
Yeah, I'm here to seek therapy because of this uncontrolled depression. I've been eating uncontrollable, and I have this problem with alcohol, and also I'm out of my medication.
Okay, let's see how we can be of help. Following our last session, how have you been doing?
A little better. When you say a little better, what do you mean?
Anyway,
I've been taking my medication. I've had less argument with my mom. We've not been fighting again over financial issues. I've not gone to the gambling house since the last visit. But I'm still kind of depressed. I guess maybe but anyway, I eat and I drink when I feel like stressed out. I'll drink and eat. So I think that's still the concern, you know.
Okay, you are taking a good step in the right direction, which is fine. I give you some forms to fill out last time. Do you have them?
Yeah, they're here.
Okay. Thank you. So you have some success in the past with changing behavior, and if you were to decide to make any changes here, it sounds like you could drop all that you make make those changes. How important would it be for you on a scale of 0 to 10? 0 is not important, and 10 is very important to do something about your drinking.
Well, if that drinking is increasing my strength, and you're not going to prescribe any medication for me because of the drinking, then it's fairly important. Maybe a 7.
That's why you should choose 7, not 5. That's good. Okay. So,
well, again, as I said, I need to have things under control. You know, I feel my mom is sick because of me, and I need to ease my financial stress. You know.
Oh, okay. Now, how confident that you could do something about your drinking? How confident are you?
Well, the risk that I mentioned, that you mentioned some risk about interdrug reaction with respect to the medication that I'm taking. If that's going to affect it, then I'm very confident that I'm going to keep it up.
Okay, that's pretty high again. That's good. Okay. So some good motivation. Generally, you have a goal now, as well as you're pretty confident that once you decide to do what it is that you decide to do, you'll be able to follow it through. So that makes it make change behavior, imagining things that more interesting. If I have some information here, if you are interested, some pamphlets or on alcohol and all of that, I'll give that to you so that you can look through that. Lot of luck. It sounds as though you are really committed to making these changes. I'm here to work with you, and you can call me anytime you want.
Okay.
I will see you next week.
Okay, thank you. Thank you. I think that will help.
Okay, day 2, CBT, positive self-affirmation. Good morning. How are you feeling today?
A little better.
Okay, during this session, we are going to help you develop a positive power of conviction, knowledge of disapproval situation that are antagonistic to what we call a negative core belief. I think this will create an increased certainty and confidence of self. What do you think?
Well, that will be fine.
Let me explain. I shall be doing so by so you understand what we are going to do. It's a 6-step process which shall be repeated until we are at where we want to be. First, I will identify your problem, then we shall find the root of the cause of the problem, and then we shall build up motivation to take care of the problem, and then we shall reprogram your mindset, and then we shall take action to eliminate the problem, and finally is what we call self-mastery. How does that sound?
That sounds good.
What area do you think is causing you the most functional impairment, and what I want us to take care of?
Well, my health, this stress, the depression and the way it affects my mood, I think that's the most important area.
Okay, now, why are you depressed and stressed out?
Because of all this tension in the house. Okay,
I see. So, where is the tension in the house?
It's my mom who is causing all the health breakthroughs,
Okay, what do you think your mom is creating all this problem? Why do you think that?
She says I have to go to school.
Okay, so tell me, what do you want to? You don't want to go to school?
For real, I don't love to.
So why don't you love to?
Because this new school is boring to hell,
Why is it boring to hell?
I don't have friends. I don't react to people. The people in the school are funny. They act funny.
So why don't you have friends?
I'm not a social person. I'm not good at making friends.
Okay, that's fine. That's what we call a core belief or limiting belief that we have to take out from your mind. Who are you is 80%. Your mindset is 20%. What we call mechanics. So what you think affects your emotion, and your emotional determines your mood, behavior. And so I say I'm I'm not good at making friends, yes. Or no, is that is a true statement.
Yes, it's true. I just hate people who cannot mind their business, putting their nose into people's stuff. I don't like that.
Okay, that's fine. Think about this answer well. Can you absolutely say beyond doubt that it's true that you just said that?
Yes, I think it's true.
Okay, that's fine. Tell me what happened when you believe that thought.
Well, I just want to be by myself. I want to stay away from people. Let me alone.
Okay, now tell me, who would you be without those thoughts?
I don't get it. You mean how I would be without those thoughts?
Yes.
Okay, yeah. I would like to love people. My age. I would like to interact. No fear of being observed or criticized.
Okay. Bibi, you did well. We have made great progress today. For the next session, I will give you this homework. Remember that I say was a core belief. Those negative thoughts about yourself, I want you to write them down all in your negative core belief that comes up in your mind. Then for each negative core belief, I want you to write down 5 experiences in your life that disapprove of those negative core beliefs. Finally, whenever those negative core thoughts come up, I want you to say it loud and clear, but in the past. For example, I am not good at making friends because I was not good at making friends. I want you to find your brain with positive, to feed your brain with positive outcomes, focus statement. If you think that you just said what you said is not true, give your mind evidence to the contrary, such as reason I say I am not good making friends is because in Arizona I was popular around my neighborhood. Think perception, evidence, time, and new time equals to new me. That is perception plus evidence plus time equals to new me. Okay, day 3, interpersonal psychotherapy. So, Bibi, how do you feel today?
Oh, I feel great, a little bit more relaxed. Things got better with my mom. The good thing is that I went back to school. I met this guy in school called Alain. He's God sent, He linked me up with some pals, and since then things have been fine. We have a study group. I think it's coming up.
Nice to hear that. I'm happy for you. Bibi, today we are going to focus on your relationship. You mentioned before that you had felt closer to your parents at one time than you do now.
Yes, before we moved to this team, I was very close to my mom. I don't know why. I'm just so angry with my mom, but I feel she does not understand me, and she doesn't respect me too.
Oh, really? Okay, is there something about this transition that's been very difficult? When your relationship with your mom moved from one of those inner circles to the more distant one, your mom still feels she has to protect you. I could see as you are speaking of her that this is quite a painful thing for you.
Yeah, it's painful because honestly I love my mom, but things seem to be like difficult since we moved here in Houston. I don't know why. She's not respecting me.
Oh, what you have described about your mom is being out here, even though you would like her to be closer. That's exactly the focus of the work that we'll be doing today. We'll be looking at those important relationships and finding ways to bring those people closer to you. What I want you to do for next week is to write down all the good things you can think about your mom. Also write down all the things that are not so good with your mom. Then we shall go point to point and see how we can correct those issues that are barriers to your healthy relationship with people around you. What do you think about that?
I think it's okay, but you need to speak to my mom to respect me a little bit.
Okay, that is fine. All right?
Okay, thank you. See you next week.
Bye-bye.
Bye-bye.